all right? Hi, Carol. I'm Kate. I'm going to be your night nurse.
Hi.
How are you feeling?
Good.
Congratulations.
Thank you.
Who's this little peanut?
This is little Covita.
Oh, Covita. She's so sweet.
Thank you.
It is a girl, right?
It is a girl.
Okay.
Yeah.
You know they all look the same.
I know.
Okay. So, you delivered this morning. You've had a whole day to, are you breastfeeding?
I am.
Breastfeed and get to know your baby. And you're doing well?
Yeah, we actually just got done feeding.
Wonderful. How long did you feed for?
It was about 10 minutes.
And did you do both breasts, just one?
Just one side.
Which side was it?
On my left side.
Did it go well?
I think so. It was a little pinchy, but
Oh, okay. So a little bit pinchy. Next time you go to breastfeed, why don't you just call me in so I can just check out the latch and make sure that it's good. Pinchy usually means that the latch could be better.
Okay.
Tugging is what you're kind of looking for more than pinching. And I'll show you the next time you breastfeed, if you feel that pinch, what to do to get the baby unlatched and a better latch. Okay? But great job breastfeeding.
Thank you.
That's hard work. Pain-wise, how are you doing?
I'm fine.
You're doing okay. So if 0 was nothing at all, and 10 was the worst pain you've ever experienced, what would you call it?
Probably like a 2.
A 2, is it mostly in your vagina? Is it in your uterus? Is it cramping when you breastfeed?
It's in my butt.
It's in your butt. Okay. Did you have hemorrhoids before you delivered?
Yeah.
Okay. Did anyone bring in Tux pads or our Proctofoam yet?
No, I have no idea what those are.
Okay, so Tux pads have witch hazel on them, which soothes like the burning, itching sensation that hemorrhoids have. It also helps with the healing of the whole area. You had a 1st-degree tear, and this is your first baby, so a 1st-degree tear is actually, as much as it's painful, it's probably the best one you could have gotten, so that's great. The witch hazel pads will help with the healing of your tear, but it will also help with your hemorrhoids. So I'll go get some of those for you. And the Proctofoam is more of an internal medication, so you put that inside and it helps with the pain.
Okay.
So I'll get you both and you can use whatever you want. Maybe try both and see what works best for you.
Okay.
Okay.
Are you gonna show me how to use it?
Absolutely.
Okay.
Yep. If you just ring me when you're going to the bathroom, I'll help you with that.
Okay.
Sorry, I'm gonna make myself little notes so I don't forget what I'm gonna do for you. Okay, so pain's doing okay. You had time on ibuprofen pretty recently, so there's nothing I can do for you medication-wise right now, but if you need like a heating pad when you breastfeed for your uterus or anything to help with the cramping, we can do that. It seems like if it's just the bottom that these medications will help. Okay. And it looks like you're still on your labor bed, so I'll change that up for you and get the big fat postpartum mattress pad, which is super cushy, and it will help with that pain as well.
Oh, good. These beds are so uncomfortable.
I know they are. Those couches are almost more comfortable, so I feel bad about that. But safety-wise, they're the best thing. And with breastfeeding, it's nice to be able to elevate the head of the bed. I know at home we're on these flat beds and that maybe doesn't have enough support. So you could even try, I could bring in a cushion, a special cushion to use on the rocking chair. And if getting out of the bed for a little bit, sitting on the couch, or even switching to your hip instead of straight on your bottom in the bed, that might help with that pain as well. Okay. Do you mind if I just do a set of vitals and listen to your heart and lungs?
Sure.
Perfect. I'm just gonna pretend to do the blood pressure. We would get a blood pressure, a pulse ox, oxygen saturation, pulse. I'm gonna listen to her heart and lungs as well, but we would get the vital signs off of the automatic. If you've recently delivered, your monitor is gonna be in here and you can still use that. Normally, since this is a setup room, all this stuff is in here for labor, but normally I would just be bringing in a normal vitals cart, get all of those, get a temperature.
Talk about frequency.
So when a mom first delivers, it's every 15 minutes 4 times, so for the first hour, and then we do an hourly after that, and 2 4 hours. And then she's Q-shift. So this would be for her, she's already had all of that, this would be a shift assessment. And then after the vital signs, as long as those are within normal limits, then you go ahead with your head to toe. So already from the door in my conversation with her, I've assessed her pain, I've assessed some of her feeding things, although I haven't looked at her nipples yet. It sounds as if she may have some redness or soreness associated with a poor latch. So I am gonna look at her nipples. And not today. But that is what you would do. And then I would also listen to heart and lung sounds. If a mom is mobile and not epidural or anything else going on that keeps her from easily sitting forward, you want to get all the lung fields, and you want to listen to the front and the back and the side of the lung. Especially today with COVID-19, before and after every shift, every time vitals are due, you also should be listening to lung sounds to make sure. The only thing that I've seen so far in labor and delivery information, and all of you know there's no like studies yet to show best practice or evidence-based or evidence-informed practice yet. There will be, not yet, to show exactly how this goes. What we have heard is that moms that are asymptomatic but are positive generally show symptoms after delivery or with acute things going on in pregnancy. So for this mom after delivery, we would just want to make sure that we're keeping up with shortness of breath, cough, sore throat, cold symptoms, fever, and lung sounds. So listen to the lungs, listen to the heart. The other thing that I've noticed is her neuro. So we don't do an intense neuro exam here unless there are symptoms to show that we should. What we are doing, however, is we are assessing her alertness, her orientation. All of those things by conversation are appropriate for her, so she would be alert and oriented ×4. You know, we've talked about she just delivered, she knows she's in the hospital, we're talking about her baby, her breastfeeding. She's very alert and able to be a good informant for herself. So she's good with her neuro. Everything you chart here at St. Mary's, you chart by exception. So it would be like if it's not within defined limits, and it tells you in your charting what those defined limits are. If it's outside of that, you would say it's an exception, and you would do a more thorough assessment to state exactly what the exceptions are. So the other thing that I'm going to do as I listen to her heart and lungs is I'm going to palpate her extremities, make sure there's no swelling. I usually palpate the legs and ask if there's pain to make sure that we don't have a clot issue. There would be heat, swelling, redness, pain at the extremity. I will do, if I notice a lot of swelling, or if she had any previous blood pressure issues at all, or any changes with headache, visual disturbance, epigastric pain, nausea, vomiting after delivery, or there's changes with her blood pressure, I would then do a more thorough reflex check, clonus check, and go into all those questions. If a mom complains of a headache rather than pain in her bottom or her vagina or cramping, then that would lead us to do a more thorough preeclampsia assessment. You're at risk for preeclampsia up to 6 weeks postpartum. So I've checked that, I've looked at her skin. This mom is fully dressed, but most of the time when you come in on day 1 after delivery or day of delivery, moms are in a gown. Sometimes they're in their own clothes by now, but occasionally they're still pretty undressed. It's easy to palpate their fundus, to check their bleeding, check their pad, and also you're getting to see a whole lot of their skin to make sure if there's skin issues or not. If I were admitting her, I would be asking the question, you know, I usually say to my moms, is there any open areas of skin or anything I should know about? And generally speaking, they don't have anything like that. If they did, you'd do a more thorough skin assessment. All right, so we've done vital signs. I've asked about pain, about breastfeeding. How's your bleeding?
It's good. I think it's like a half a pad or so, but I only change it like every 3 hours or so.
Okay, so I would love for you to get up and pee every hour or two while you're awake. When you're asleep at night and you're able to sleep for probably not more than 3 hours, you should be feeding your baby at least every 3 hours. Then get up and pee before you feed, and hopefully dad or your partner can help change the baby and get the baby ready for a feed while you're doing your thing, okay? But keeping your bladder empty allows your uterus to go back down to size and keeps you from bleeding too much. So if you let your bladder get full, you'll notice more bleeding, okay? And just so you know, and we'll tell you this when you discharge as well, I want you to be watching your bleeding. So too much bleeding is filling a pad, fully saturated front to back in an hour, okay? So anything less than that is pretty normal.
Okay.
And you'll notice over the next 6 or so weeks that will taper off. Don't be alarmed if you start to bleed a bit more going home. You're doing more movement, you're walking more, just getting in and out of the car and back into the house is more than you've been doing here. So, but I want you to start to balance your activity with your rest. It's okay to get up and move around the room. I would encourage it every few hours. you know, you're at risk for blood clots while you're pregnant and after delivery, so you want to balance some activity with that. Okay? Are you sleeping when baby sleeps?
Sometimes I'm trying to.
Yeah, it's hard because it's so exciting and you have so much adrenaline and hormones pumping right now, but in a couple of days you're going to crash, so you want to make sure that you get that sleep while you can, okay? I know 3 hours is not a lot, and really with feeds it ends up being more like 2 once you get the baby back down, so nap while the baby naps. All right, ladies, what am I missing?
So on a multip, you might want to just kind of put pressure above the perineum.
Let's talk about the fundal assessment. It's hard to do in a sim. However, do you mind if I touch you and actually try to show it? Okay. Remember to put the bed up for yourself so you don't kill your back. So mommy, you just hold on to that baby because I'm gonna squeeze bump. Oh, wonderful. Such a supportive partner.
Yes.
Okay, I'm gonna put your head back.
We tried really hard for her.
Oh, this is so sweet. Okay, so when you're palpating a fundus, and I usually do it in primips as well. I think it's just habit, good habit to get into. It's called bracing the lower segment. So you would take one, do you mind getting in and like getting an actual? We're gonna close up on you.
Okay.
Oh, is that good?
Sorry.
So bracing the lower segment is kind of holding down here the lower segment of the uterus. Now in our non-postpartum mama, I can't really feel fundus, but I'm gonna pretend and show you what that would be like. So at the level of the umbilicus, you wanna start, I kind of dig half of my hand into the belly, obviously gently. And as soon as you feel kind of the top of the uterus, which feels like this, so if you practice with your own fist, maybe it's not as firm as this because you're going through layers of tissue and muscle, but you want to get to that kind of tennis ball feeling where you're feeling the top of the uterus. Bracing the lower segment keeps moms from prolapsing their uterus, or just from it migrating down so that you can't really feel it, okay? So it helps a lot. And in multips, the uterus is more mobile, and easier to prolapse, so that's why we do that. So go ahead and feel the uterus, and if it feels really nice and firm right away, you barely have to touch it and you're like, oh, okay, there it is. You would know. At you, 1 above, 2 above, right? It's a finger breadth above or below. So that's the level. At you, 1 below, 2 below, and it will move down in the next week or 2. And after 6 weeks, it should be back down to normal. So as you're palpating that, if you find that you can't really feel it, but as you're like digging and trying to find it, all of a sudden you realize underneath it, your hand, it's firming up. We would call that firm with massage. So it took the massage to get it to be fully firm. If I don't feel a super firm uterus and their report of their bleeding was kind of like, sure, yeah, not a lot, I don't know, maybe, then I will look in the pad and check the bleeding. I'm gonna bring it back up.
What's your reports gushing while you're doing that?
Oh, absolutely. If they feel a lot of gushing while we do that, then we would check the bleeding as well. But hemorrhage is a really common OB emergency, so we're always monitoring that. I don't make moms save their pads or anything like that, but at delivery or after, if it's something that we're seeing that they're bleeding a bit too much, we pay a lot closer attention to it, and I would want to see. Also, clots are not totally normal to be like the size of your fist or bigger. We want to know about that every time. If you find that you're having a lot of little clots, but every time you go to the bathroom, just leave it in there for me to look at and let me know about it, okay? Fundus, bleeding, breasts. You want to look at the nipple. It's always going to be slightly more reddened once you're a new breastfeeder. What we don't want to see is cracked, bleeding, really chafed or chapped look nipples, and their report means a lot. So how it's feeling, right? Are they sore? How does the latch feel? Pinchy, painful. We want to come in and help that, fix that. And you know, they feel kind of like they're bothering us sometimes by asking to come in with those things. A lot of new moms, Alyssa's a lactation consultant. A lot of new moms, I feel like, kind of think pain is associated with breastfeeding, so maybe they don't report things that we could fix. Do you find that as well with new moms? So we just want to kind of like break that stereotype and say, like, it's not going to feel necessarily like clouds and rainbows and shiny unicorns everywhere. It might be a little bit sore at first, but it shouldn't be pinchy, shouldn't be super painful. It certainly shouldn't have cracked, bleeding nipples. And we want to let them know to let us know the second that it doesn't feel exactly right, like tugging, which is what it should feel like, That way we can assess it and help change what needs to be changed to make it better. I'm sorry I'm out of breath. It's hard to like talk like this with a mask on. But pandemic days call for constant masking. So we went through swelling, preeclampsia if necessary. I mean, I think that's pretty much a postpartum assessment. So we're in the room, we're talking about it. You know, things come up about pain, write a little note for yourself, remind yourself. Charting in the room while you're doing it is the best thing you can do. You wouldn't even have to make the note. You'd be in the observation, just saying what you're doing, and then that's helpful. I don't turn my back to them and chart while I have the conversation. I kind of have the conversation. Maybe I go over, make a note real quick, come back to the conversation. Or I do everything and then I open the computer and chart everything while I'm in the room. But that is a postpartum assessment, I believe.
And then possibly discussing the plan of care for the evening as far as like
Absolutely.
how frequently you're gonna do the vitals, how frequently she should be breastfeeding.
Is there testing we're doing on the newborn tonight? You know, part of the postpartum assessment is the assessment of the newborn and the mother's attachment. You know, how is that going? Do we need to go back over safe sleep? When you walked in, was she asleep breastfeeding her baby? Was she asleep with the baby in the bed? Does she look like she's dozing? If so, then we would do a safe sleep, which I think we've already talked about, and I'll do a more in-depth sim on it, but we would do a safe sleep teaching, and then we would put the baby in the bassinet for her, make sure she's settled. And then before I walk out, I always make sure the bed's back down to the lowest level, the wheels are locked, call bells beside her, within reach. I even like remind them, the red button gets to me, ring if you need anything, ring for the next feed so I can come assess the latch. And then I make sure the table's back beside her, that she has her things that she wants right there. I look around the room. Is the trash full? Can I change it? How about the linen bag in the bathroom? You know, is everything tidy? Can I tidy anything? Take out trays. Did she eat? Did she order dinner? Those are the things you want to be watching for. Pitcher of water, refresh the water, get her a drink or a snack. I'm a night nurse. I come in a little bit after dinner time, so usually I'm clearing dinner trays and I'm pushing ice cream. That's my job. Would you like some ice cream? And everybody pretty much goes for that. So that's it. Anyway, this was our postpartum sim, and I know now you're really looking forward to the other ones. Awesome.